I know you know that this is a brain because as we zoom up, we could see it looks like brain. You can already see a lot of normal blood vessels, this little Virchow-Robin space around them, whether it's an artifact or not. Notice most of the cells here are glial cells, but notice also that some of the bigger ones, perhaps here, looking a little bigger. Certainly the majority of cells are glial cells, but these look big enough to be neurons. There. And if I look a little longer, I'd probably find you a few more. The individual glial cells that probably have a little bit of fatty washout around them are probably oligos, and the ones that don't are probably astrocytes. And this is a nice brain, but why are we wasting our time on the nice brain? Let's back off and look at the big picture. The brain apparently has some blood vessels around it. I don't know what part of the brain this is, but they look awfully big. And they're not normal arteries or veins. This is what we call an AVM, an arteriovenous malformation. In the way we think about flow of blood, we think of high pressure, thick wall arteries, we think capillaries, then we think about big lumen, small wall, low pressure veins. Well, in the process of developing, sometimes the process gets mixed up, and there are communications between arteries and veins. And now vascular spaces have to handle higher pressures, and the arteries sometimes make direct communications with them. And as a result, there could be hemorrhage in that area, there could be blood clot, and that's what you're seeing here. You're seeing blood clot, you're seeing hemorrhage, and this is an AVM. They're basically all congenital. Nobody knows exactly what causes them, but it would of course have to be somewhere along the lines of abnormal development of blood vessels. Let's take a closer look at the walls. It might not be let's say appropriate or even worth it to say, well, which one was the artery and which one was the vein, because in AVMs they're basically communicating with each other. So I would imagine that the veins might have to react by forming thicker walls, and if these arteries are losing some of that pressure because of direct communication with veins, maybe their wall wouldn't be as thick, and maybe the lumen wouldn't be as small either. I can't tell you for sure this is the wall of an artery and that's the wall of a vein, but it'd be a good guess. And in the AVM, you basically have a lot of blood clots and blood mixed in a tangle of vascular lined spaces. Thank you very much.